And this is going to be your baby that you're going to hug, because I don't want you to grab me. Okay? So you're going to hug your baby. Okay?
Well, because he's saying it's because you're going to want to grab onto something, like maybe choke him.
Yeah.
He's choking you.
And I don't want you to grab me. I just want you to hold your baby and just be at peace. Okay? This is a spiritual experience. So when we do this treatment, I want you as an individual, when you're in the position that Dr. Kassar is, I want you to go deep into your meditation, and I want you to go to a happy place, and I want you to get free and let go. Okay? Don't hold on, because if you hold on, then you're resisting. And this is a very powerful, important thing that you're doing for yourself by allowing someone who has the ability to be able to do this for you. And the more you let go and just allow this, I can assure you, there is a few seconds of pressure that is not so comfortable, but it's only for a short time, okay? And the relief is immediate. So you will experience immediate relief. You just have to recognize that it's only a few seconds of discomfort. There's a lot more discomfort that you could have in your life than this, actually. So, and it's worth it. Now, I also give all of the people who are in Dr. Kassar's position something to help with, because there's going to be a lot of drainage, okay? So this is going to be for that purpose. Before we start, let me grab my sip of water. And I like the head to be just slightly tilted back. So this pillow should be okay because it has a curve, so it can slightly allow the neck to come back.
I used to use those round
I have another one that can even bring it back even more, but I don't need it to go back more than what he is right now. Right now he's okay. Okay. And so what I'm going to do now is, he probably already knows which side is more blocked. So without needing to ask him again, he can tell me right now. Which side is more blocked?
Right side is...
The right side is the more blocked? Okay. So right side is more blocked.
Completely blocked, look.
Okay.
5%.
So we are going to do the first opening on the left side. Okay.
So what he's saying he's going to do the good side first.
The better side.
Yeah.
I'm going to do the better side, the less blocked side first, okay? And Dr. Kassar, what your instructions are going to be is I am going to go all the way back through the opening on your left side, and I'm going to make a couple of inflations, and I'm going to release it. I'm going to make another inflation, a small one, mild, and then I'm going to release it, okay? And once I've gotten as far back as I need to be, that is when I'm going to ask you to take a deep breath through your mouth. And as soon as I see your lips close, that is when I'm going to proceed all the way back, okay? So the only thing you need to do is when I am ready, and as long as you are ready, all you do, and as soon as the lips close, boom, and then it's over. And we're gonna release it, and you're going to be, wow, okay? So before I begin with you, I wanna ask you, would you like to do more than one opening on each side today, or do you want to start with just one opening on each side?
Opening on each side for now.
Okay.
Yeah.
So If we're just going to do the one opening on each side, I'm going to do the lower opening on his left. I'm going to go through the middle opening on the right. Okay?
Remember, there's like 3 openings, a lower, a middle, and an upper.
Yeah. And then if we do lower left and middle right, and he says, Nick, you know, let's go up the chain. We will. Okay, we'll see. I know Dr. Kassar is a tough one, so meaning that he's highly disciplined individual who is willing to go the next step. He may. I don't know. We'll see. But anyways, or another day. Okay.
I got.
So you just relax. And just thank God that we're able to do this amazing therapy to help ourselves to optimize and enhance the being that we already are. And for me as a practitioner, this makes me feel very good that I'm able to do this for somebody, because I know it's one of the most powerful things that I can do for somebody. Okay. Okay, good.
Oh.
You're doing good. You're doing really good.
Oh, that cracked like 5 times in there already.
You're doing good.
Oh.
Yeah, good. Okay. And now you're going to take that deep breath.
Whew. Yeah, that works you.
Yeah.
The first initial one cracked maybe 5 times inside the nostril, inside, and it's not really cracked. You can feel my eyes dripping right now. Okay, and the second one, same thing. You can hear the tissues are stretching in there. And when's the last time you've stretched those tissues? Never, probably. And so it's not like cracking or anything, but you can hear a release, not so much tear, but it's a stretching of this very, small canal, night and day. It feels like, like all of a sudden you reamed out something that had a smaller opening in it. I can breathe better.
Yeah. Okay, we're going to move on to the next side.
It does feel like it's choking you at the end. Okay, but it's gone quick. But then again, it does.
Yeah.
Let me choke you. Then you'll feel it. I let go real fast, though. Don't worry.
But that was fast.
And that's what
fast.
it feels like. It feels like you're getting choked for a second, and it's the practitioner. Make sure you stretch for a second, and then unrelease it.
Okay, we're going to now go to the right side, which is potentially more blocked. Potentially, I have to use a little bit more force to get through. Okay? Okay. Deep breath. Okay, good. And this is right through that middle opening, which goes straight through. And again, I'm going to do a couple of...
Whoa.
You're okay. You're okay. You're okay.
Just the cracking.
You're okay. You're doing good. We're going to do another. Get a little bit deeper. There you go.
Yeah, that's solid back there.
And I'm going to have you take that deep breath.
But right away, this side I couldn't breathe at all. I can breathe right now for sure. So night and day.
Yeah.
And it is uncomfortable for a sec. That's why you do the side that is better than the side that's not, just so you can feel that side actually release. This side was solid, and it felt like it was a cave that had rebar around it. And so this side was a lot tougher. So, yeah, that was good though.
And I used a
breathed.
bit more force on that right side so that I could get through the blockage. I think he could feel how I used a little bit more force on that right side. Did you notice?
Oh yeah.
Yeah.
And there's a point where you'll feel the force, and just know in about a second it's going to be gone. But it's a long second. But you have to know, don't try to, what are you going to do? Remember, you're here, and you got to really relax, and it's only 1 second before
Relief.
he releases, and it's completely 100% an instant relief.
Yeah.
But again, it's inside your head, sort of squeezing from the inside out. You can squeeze from the outside in, but squeezing from the inside out, it's not too normally seen unless you do these internal therapies.
So now we just want to come back and just really put everything back together that we mobilized, and just really...
I felt my whole face stretch out, you know? You really feel it from the inside.
So it feels... good. And just so you know that that sphenoid bone also articulates with the temporal mandibular joint. So it's a really good idea to also really work through those mastication muscles, which are the strongest muscles in your body. But a lot of people over time get really, really tight muscles through there. You can really release that through there. Good. And that's super tender through there, but you get really good relief there. Okay, good. And sometimes you can really take away a headache, just really relieving those mastication muscles, the TMJ. Okay.
Yeah, that totally releases it. That hurts in there too when you get that done. Again, remember, when's the last time you had any of this stuff done?
And I like to look for areas that we can mobilize just below the occiput as well.
And this is an art, guys, so, you know, I mean, a lot of people may be seeing this on YouTube. They'll say, hey, I want to give that a try. Well, you know, a practitioner means you've been practicing for a while, and the first couple of people you do it on, you really are practicing.
Okay, we're going to really move that right there. Okay, take a deep breath. And all out. Just let everything go. We're going to squeeze that joint all the way. Let it go, let it go. There you go.
Oh, nice. And if you can't hear that, guys, well, I did inside my head.
Yeah.
And this is what a master, you know, apprentice does as a doctor of chiropractic in moving these joints. This is a serious art.
Small one right there. So we're going to have you take a deep breath and let it all go. And what we're looking for here is we're looking to get as much rotation and squeeze that. So that was just a little one right there, but you could hear it if you were up close.
Nice. Oh, that moved a lot in my neck.
Yeah. Okay. So this is part of that cranial facial release, is just really looking for areas just below the occiput. After doing that intense adjustment, just continue to release all the joints from head all the way down.
And everything does feel released. Okay, like I said, I don't have anybody to do this to me, but I could do it to everybody else. So the practitioner's the problem. Okay, and what a beautiful thing to have.
And now I'm going to have
this.
you open up one palm of your hand. Okay. And this is an amazing natural essential oil that we use with this therapy, and I'm gonna have you rub your two palms together, and without touching your nose or your face, I want you to come as close as possible without touching, as close as you can, and I want you to take a super deep inhalation through your nose, both nostrils, and really try to take as deep of an inhalation as possible and feel how deep that penetrates. So this is full of natural essential oils, and this is a really powerful thing to use after doing the cranial facial release therapy. Okay.
And it's a menthol type, you know, really.
A lot of wintergreen.
Camphor.
And there's like 5 different ones. I can't remember them all offhand right now.
There, I think too. Yeah. Wow. I mean,
it's called Thai Fu, but it's a really good one.
And sometimes when you get this done, for a day or two, you may have a little soreness in your throat.
Yeah.
Okay, because you're stretching the back of the palate. You will be able to swallow your food, okay, easier. When you breathe, you'll be able to feel like you breathe easier because all that tissue now has movement in it. Remember, how do you massage the inside of your back of your throat? Impossible. So this
it's different.
Really
it's a different symptom than an infected sore throat. There's a combination of reasons why you may potentially have a mild sore throat after this therapy.
Yeah, it's not infection.
Okay, number 1 is the detoxification. Oftentimes you'll feel a lot of drainage of toxic materials draining through. Number 2 is the trauma of having the balloon touch the back of your throat. Okay? And so the combination can potentially lead to a mild sore throat.
And I can feel the draining down my throat. Remember, there's all these lymph glands back there. So, you know, push this all the way in the back, and these lymph glands in the back, which again, you can't get to, I can feel it draining down my throat. If I swallow, it's thick too. It's not like, you know, like snotty mucus. This is like peanut butter. Yeah. And of course, if you can get it, spit it out. But you know, if not, put it back down in, and it'll just go ahead and get recycled again. But this is, remember, this is one of the most like weird feelings, just for like a second. So a lot of people sometimes, when I used to do this to them in the office, they'll only let me do one side at first. They'll say, okay, I'm good. Just like the same with Sananga. Oh, no. One drop. No, you just do one side. And if you can, even if you have to do the other side lighter, okay, then at least try to even it out, because a lot of people I've had, I don't know if you've had that problem, they go, no, I'm good this time.
Oh, of course, yeah.
Yeah, because it scared them a little bit.
Oh, yeah.
Okay, so, I mean, I've done this probably thousands of patients. Probably 30% of the people I did this with on a treatment level where I did it at least like 4 or 5 times. I probably did at least 50% of the people once, and they'll never do it again. Okay, maybe even more. But people that would go through a therapy treatment would be usually 30%. And those are usually people not just doing it just because, it's because they got a lot of problems in their sinuses and they're trying to find relief. So, yeah, that was good. Thank you.
Yeah.
Yeah.
And if you want, we open up all 6.
Do you want to do the Sananda? Or
we can do the Sananga with you, because it makes it even more powerful when you do Sananga after you've had cranial facial release. In fact, if you do any practice with any entheogen, in my opinion, doing cranial facial release is going to unlock a lot of what you're trying to experience spiritually. Yes. So by unlocking physically, using the entheogen spiritually is going to make it even more effective. Sananga is categorized as an entheogen, meaning that it is able to help to unlock brain capacity and open up your ability to be able to have a deeper spiritual experience. So yes, if you are ready, we can apply 1 drop to each eye.
I've done Sananda A lot of times. And it is, and I've done ayahuasca many, many, many times, and this activates all your senses in this area. And it does hurt. It's like these two therapies are like therapies like aren't really feel good. And if you do them once, you may not want to do them again. But promise me, you know, if that happens, well, do it again. Okay? And if you don't do it again, you're missing out, because sometimes it takes a few times for you to really get the release, because the first time you're just scared. It's like your first yoga class or your first anything. So,
Okay. Yeah, sure. Yep.
Okay.
Okay. And I'm going to have you help open both your right and your left so that we can easily get one drop on each, inside each eye.
And you'll feel when you do this.
Open them both, and then we'll try to get them real quick. There.
Yowza. Woohoo!
Got it. Relax, deep breathing, deep breathing.
Just showing you that I could sit here like this, like nothing too, but I want to show you what everybody's gonna do. Whoa, baby.
Yeah.
And I can sit here like this too.
You may scream, you may cry like a baby.
Oh, but I'm telling you what normal people would do, because they go, whoa, oh, ah.
Or you may just soldier right through it.
Or suck it up and just cállate. But I did the movements, and now it's going down. But it's sort of like the throat, and I can feel, you'll feel when you do this, you'll feel like grits of glass that come out of your eyes. It's super clean. Oh, and it's still burning good. Ah.
Yeah, it will burn for at least 5 minutes.
Oh, and now it's draining all inside, where he just did all of that.
Exactly.
Now it's draining. I can feel it all working in the areas.
Yeah. So on a physical level, the Sananga is dilating capillaries, okay? So that dilation effect is helping restriction, constriction, capillary constriction. It's very important because the eyes are getting blood flow through very, very tiny capillaries. And when those capillaries get constricted, it leads to a variety or a host of different types of eye conditions that can develop.
Well, I turned my eyes around. If you turn them around and roll them around, it gets deep inside the back, because you can drop them on the front, but that's just sort of like beginning. But if you really want to get it, you got to roll your eyes everywhere, and it works you again.
From 1 to 10, a scale of 1 to 10, how painful is it? 10 being the most painful.
Well, it's not so much painful, it's burning. It's like probably an 8. I'm hacking it. If not, I'd be rubbing my eyes and stuff, and try not to.
No, don't rub your eyes. Don't touch your eyes. You can try to open them while you're with the Sananga, and you're going to get another intense feeling happen again. It'll burn again when you, open.
Oh no, this is like good torture now. Oh.
Yeah.
But it's super cleaning inside. It's like roto-rootering. Oh.
And Kleenex if you need it. So you can start to get some of that drainage out.
That is painful stuff.
From your nose, I mean. From your nose.
Yeah. Let's get this here.
Makes me really want to do it.
Hey, all right, Dr. C. Let's do an experiment.
There you go. See the snot in there?
Yeah, that's what I mean.
Before, it's all super drainage. Now it's, I can feel, once you get done, you just feel like, man, whoa. Ha.
You feel
everybody needs to do that, but while you're doing it, whoa, I don't know if anybody wants to do this.
Yeah.
Whew. Now it's coming down, but this is like a walk in the park. You know, no, excuse me. The sinus one is a walk in the park compared to the eye one, and you'd think it'd be the other way around.
Yeah.
So
the Sananga is considered eye medicine, but it's really a facial medicine, because you're actually able to clear a lot of facial release with the Sananga, more than just the eyes only.
Here, give me my glass. I don't want to swallow this stuff. Look at my eyes dripping.
Yeah.
Can you see that, Carlos, with the camera?
Yeah.
Oh, okay.
Just take a sip and I'll tell you, I'm gonna guide you through
My mouth is just
Don't look into the light.
working.
Force them open and let them tear up.
Woo, doggy. Yeah, baby. Yo, baby, yo. I can say a lot of other things, but. Woo! Yeah. Okay. What a ride. And if you don't do it, you're being wussy. Okay? And wussy doesn't mean anything more than wussy. Okay? Remember, I did this for you first to show you, to take the courage to show you that this will work you.
Most people were screaming and crying last night.
Yeah, last time was very intense. Yeah, right?
That was beautiful. It's because you feel like you just, it feels like you just got you born. I can't even talk now. It's really working you good. And you do feel it, not psychoactively, but I do feel it in my head, for sure. Okay.
All right, who's next?
Well, be careful. We don't want to advocate walking until you fully have recovered, because.
No, totally. And also.
So we want you to stay down until you've fully recovered from the Sananga, because otherwise you can't really see very well, and
if you're watching this on YouTube, where are you going to get this? You better watch yourselves too, because there's a lot of people selling a lot of Sananga. Okay, and I'm not sure if I trust them so much unless practitioners will go ahead and actually show you maybe where to get it, or your practitioner maybe will learn how to do these treatments, because that's what I would like to see, because these do take some skill. It's not something you're going to play around with at home. I mean, the eye thing is one thing, but you're not going to do this on your own, because I can't still see.
Yeah.
So you have to be, someone's got to watch you.
yeah.
And it is a therapy that's going to probably be one of the most aggressive therapies. Feeling. You think an enema's aggressive? This is way more aggressive. Because the enema's way away, and you can hold the enema and let it out. This one just keeps on working and keeps giving you your money's worth.
Yeah.
But I can feel drainage again.
Yeah.
Like there's a whole nother layer of stuff coming through me.
Yeah. And you'll feel really clear through here.
And you can see my eyes are dripping again.
Does it still burn right now?
Not really, but
It's coming down a little bit, but
gritty. It's all full of sand inside, and this is
Yeah.
when you got a good cleaning. You'll feel it's like pieces of grit, and that's all the stuff that came out of your ocular. Remember, and now since I've had this work again, I'm gonna move my eyes all in a circle, all the way around. I can feel it way in the back. So what I do, and I tell patients to do too, okay, because I'm doing this for a while. A lot of people can't handle it, in the beginning. So don't move your eyes. Just keep them straight. Because if you move them more, it's going to go further back. Let them take the first few and let it go through its first cycle. And then, like Dr. Nick said, if you want some more, roll your eyes. And then it'll go into the second stage, which is deep. And that's where I went through my second stage. And that was more aggressive than the first. I've done this a couple times where I've rolled my eyes a lot, and that was like, that's not good for you guys to do if you want to, get the full treatment very quickly like that. But I think it's easier just to keep your eyes straight, let it do what it's going to do, and it may take you 30 seconds to a minute. I can feel tons of like glass inside, not glass, but like sand in my eye. And then once it feels like it comes down where it feels, okay, this is pretty comfortable now, okay? You may want to, just like Dr. Nick said too, open your eyes a couple times before you even roll them. And then, boom, it's going to grab you again. Okay,
Again.
Let it go through its thing, and then when you feel like, okay, you've already, gone through the first two layers, then what you do is you just roll them around in circles like this. It's hard to do even right now, but I feel this stuff on the third round. It went all the way behind my ocular region. There we go. It should be red as red.
yeah.
Yeah.
There. Okay, I think we're good. Now I can go dancing. Yeah.
Whoa! Dr. Kassar wants to dance. Woo!
Thank you, brother. I have to give him a hug because I haven't been tortured that good in so long. See, I don't get tortured. I got to torture myself. So, kudos. Okay. That was good, and I'm glad that again. Let me get out of these lights. I'm glad that that these therapies, because these are all hidden therapies, and these are like just like doing an enema. You can do it with water. You can learn how to do it with different liquids. Okay, you can clean your ears with Q-tips and shove all that stuff in, or you can learn to see what's in there first, and then you go ahead and say, whoa. So we have a good video camera that we just bought. It's called the Firefly. And we can look inside your ear, which we'll do, and we'll show you what lives in your ear, and you may have little bugs in there crawling around. See, it's working me again now. And it takes like 30 minutes to go through this whole cycle. And then you can see, thanks. Then you can see basically what you're up against in your ear, and we'll show you how to scrape some of that out and to clean your inner ears, but you must see first what it looks like before you start playing around doing anything in your ear. And you'll be, let me tell you, you will be surprised. Okay, here we go. As you can see, my eyes are red. Part 2. This is, again, cranial facial release, and my eyes are red because of the Sananga. So Dr. Nick is going to go ahead and do all of the people here, but I just wanted to show you real quick. This has been now about 10 minutes, and then maybe more. It's been like 20 minutes since I put this in. And this is one of the best cleanings. Okay, listen to my nose. I never drained. I got so much stuff that drained here from not only the sinus, okay, nasal, stretching, the cranial facial release, but from the Sananga. And the Sananga, do it, because you can do this to cranial if you want to, but the Sananga is really a plus. I can't even see, but it's still working me right now. But it doesn't hurt anymore. And I felt like just for about 5 minutes, I had tons of sand came out of my eyeballs, but right now, they'll come back, but they feel like they got super lubricated right now. And my eyes did drip a lot, so where did it come from? Mm-hmm. Yeah, and then where did that sand, you'll feel the sand. Where did the sand come from? It came out from whatever it is. All I know is, wow, it's clean now. Okay,
and it's
Dr.
deep.
Nick.
Okay.
Have fun with everybody. And Martin's the first. That's your baby. You're gonna go. Why? Because you're gonna have to hug something, brother. Otherwise, you grab him like this.
No, don't grab me.
Yeah, no, you'll grab him because I know people used to do the same thing. They grab you out of. You don't even know why. You just grab something. Yeah. And if you're a woman practitioner, you would say, no, hug that thing. And you get away with it too.
Thank you so much.
There we go. Are you ready? You should be. Are you ready? Hold on. You should be. Oops, sorry.
Yes.
That's what that always does, shaking you up to get you even more scared.
Works like a charm.
And Martin, how do you say it?
Martin.
Oh, det är inte så.
No, it's really easy. And the older you get, like I said, the more sometimes you get a feeling. You'll notice one side feels like it's completely broken, like shut, like a cement wall, and the other side is very easy. But you will feel under the release, the first, soon as he pumps it up a little bit, you will feel this crunching. And that's just the beginning, even if you only got that part. And I used to do therapies with people because they didn't want because I tell them, look, there's 2 parts of this therapy. There's the first one where you just stretch out the nasal, and then the second one where you actually go into and you really stretch and it goes down the throat. But some of the ones that I just stretch it out and just let it hold there,
one
and stretch it a
side,
little bit more.
and I want you to, and then occlude the other side. And I want you to tell me if there's any difference between left and right. Harder. Do the other side harder. As hard as you can.
This.
And is there any side different from the other?
Yes. This one is
This one is more occluded?
more occluded, yes.
Okay, all right. So just like Dr. Kassar, then we're gonna go through the left, lower, right, middle, okay? Same as Dr. Kassar.
Pull that corner.
And same instructions. I'm going to go all the way back as far as I can get. And once I've reached as far back as I can, I'm going to do a couple of small inflations, okay, and release. A little bit of an inflation and release. And once I've gotten as far as I can, I'm going to then ask you, and I want you to open your eyes so you can see me, because I want you to do it the way that I'm going to show you.
Okay.
I want you to take a deep breath, and when I see your lips touch, that is my sign that I'm going to go all the way back, okay?
Okay.
All right. So your only thing to remember is when I'm ready and when you're ready, I'm going to have you take that deep breath.
Step on that there.
Okay.
There we go.
Okay, and just go to your happy place.
Maybe get a good zoom on that one.
And just, we're just thankful and grateful that we have the opportunity to receive and give. Relax, close your eyes, you're good. Just relax. So that lower opening goes down at an angle to get into there. Just gonna... Good, good. It's going in nice and easy, so that's good.
Martin's a tough dude, so. See? Because I worked on him outside.
So now you're gonna take that deep breath.
Working on him.
Take that deep breath through your mouth that we talked about. There it is. Good. And that side was pretty easy for him, actually.
Wow.
How was that for you?
Great.
Good.
Got a nice little, yeah. You can see stretch, yeah.
Okay, and then we're gonna immediately now
My
we're
side's
gonna
so deviated. That's
we're
why
gonna go
mine was
right
more-
through that right middle opening. Okay, just relax. And we're gonna go all. There we go, all the way back. There it is. Good. And again, we're gonna do a little bit of inflation to get through there. And that side's a little bit tougher. Good. And now take that deep breath when you're ready. Stop. Okay, let it out. Okay, do one more. Okay, good. And we got some blood. So that's good because we broke through some areas that were obstructed. Okay?
If you need to, yeah. Now you're good on your nose.
No, he has this.
okay.
So this is good for people to be able to see this. When we break through a barrier like that, you will see some old inflammation that we had to break through.
Polyps.
Okay?
Stuff growing in there, who knows?
This is old chronic stuff that we're trying to get released. So this is good. And if you blow your nose right now, you may see some
Blood.
red. Did you blow your nose?
You've been referred for a reason because your GP couldn't
And we're really
teach you what to do.
moving everything that we stimulated to process through. Really move all this
See, my eyes now actually just recovered pretty good. And it's been like 30 minutes. But it did take me through a full circle.
We really move the sinus fluid through.
I'm gonna run out of battery.
Oh, you need a battery?
Yeah.
Then we
Need a battery or
Is-
plug it in?
Do you have what to go out?
It's gonna go out.
Oh, let me get it for you. We can plug it in too, we'll get it.
Open your mouth. Open your mouth. There you go. Good. There you go. There you go. Good. Okay, good. Okay, now you can close your mouth. There you go. There you go. Good. There you go. Good. Okay, good. And we really want to open up all those joints. Really open it all up. So we're right underneath the occiput. We're really opening up all those joints really nice. You can really feel all these areas here. And when you get to a tense area, like right there, he can really feel it. What do you feel in there, Martine?
Pain.
Are you ready? Are you ready to let that pain leave?
Yes.
Good. Okay. And let's see how this one is on this side. Really. So not so bad there, but we definitely are gonna find that one right there. Take a deep breath and let it all out. And then what we're gonna do is we're gonna move that joint through and let it all go, Martine. Good. There you go. Okay, good. So I'm looking for rotating to release, okay, to increase that rotation of that joint. Okay, good. So it'll stretch there. This guy's super tight. He needs a lot of work. He's softening up though, I'm sure. Okay. Okay. Good. So for the eye therapy, what I like to do is I like to, at the end of doing the cranial facial release, we're gonna move this table and everyone's gonna be able to lay face up, and we're going to let everyone have the experience in a group, okay? So it'll move, it's nicer when you do it as a group as well, and it's more efficient as well, okay? So,
So you gonna do this on him later, or no?
yeah, well, we're gonna do it as a group.
Oh, as a group?
Yeah,
So
so,
all cry together.
yeah.
Yeah, that's good, because they're working out, feels good with my eyes, they're pretty red. Yeah, pretty red.
Okay, how do you feel?
Great.
Good, yeah?
Really good.
Yeah. Okay. See, he feels good. Oh, no. Oh, I forgot one more thing.
Essential oil.
Yes.
Ah,
Okay,
yes.
so open up one palm of your hand. And we're gonna,
It's a good camera. We should have been using this.
there you go. And rub your two palms together without touching your nose or your face. I want you to get as close as possible and take a super deep, strong inhalation.
Put your hands closer, Martin. Fast. Yeah, there you go. Breathe deep, deep.
Super deep, and really feel the intensity of that going all the way in.
You just stretched all that in your nasal stuff. Now when you put it in, All of a sudden you can breathe. Talk about some fresh nostrils. It just got the rotor rooting. Yeah. Without calling a plumber.
Okay, good. This is a spiritual
I'm
experience.
just gonna say that. This is a super spiritual experience. It's because it is. When you get done, it feels like you just got renewed to some degree.
Wow.
Okay.
Incredible.
Yeah. Okay, thank you, Martine.
Thank you.
Courageous victim, first one. And look at him, he's getting abdominals now. He's getting a little belly. And now all of a sudden I see your muscles in your stomach. There, he's turning back to the rugby man.
Marina, are you ready?
I got your baby for you. I'm keeping it warm for you. Okay.
And Marina has a history of some head discomfort, would you say? Is that correct? How would you describe how you feel in your head sometimes? You don't feel so good in your head sometimes, is that correct?
Yeah, headache all the time,
Headaches.
and I had 2 injuries.
And the 2 injuries to the head.
Yeah.
So, so this treatment is very good for someone with her symptoms. Okay. So, and also we can see through the nose here. Have you ever had any nose fractures?
Yeah,
You have.
it's in the forest, some pine trees.
Mm-hmm.
Pine trees come in my nose.
Mm-hmm.
Yeah.
Okay.
It's yeah, it was here.
Yeah, so there's probably a lot of scar tissue buildup and calcification.
And here, when I was child, I felt down on the table,
Mm-hmm.
and I have some scarf, right? Some scarf here.
Okay.
So I broke my nose 5 times, so when you saw me squirming a little bit, it's because my nose is messed up.
So I'm gonna have you
So it does help a little.
come down towards your feet, maybe 2 inches or so, not much, just to be really relaxed. And then I'm gonna have you move that way, maybe 2 inches. Yeah, okay. And then I'm gonna help you to tilt your head. There you go, good.
Grab it.
Yeah, and that's gonna be your baby. Yeah. Okay. Okay. So I'm going to have you occlude one nostril and then the other, and I want you to tell me, do you experience any difference in your breathing capacity through one nostril or the other?
Right now, this difficult. This is more easier. Left side is more.
More difficult?
Right now, yeah.
Okay. And do you know if that's normal for you, or do you not know because you don't normally test this?
On the workplace, I work a lot with chemicals. Sometimes I wake up in the morning and there's a full,
Both sides?
both sides.
Okay. Okay. So there you go. Okay. So I think based upon where I notice structurally it appears as though she may have more blockage up further. So what I'm going to do is I'm going to, for her situation, I'm just going to do the largest opening for both sides and see what kind of effect we get with that for her. And we can always go back to the lower openings. In fact, I would love to also go through the upper openings eventually as well, because she may structurally have more blockage all the way up into the upper opening. But let's just see what kind of effect we have just by doing the middle openings on right and left, and then from there let's see how best to proceed after that. But just structurally, I'm thinking that the best thing we can do for her is upper. Okay, so we're gonna go through the right side first, and then we're gonna go to the left side. Okay. Okay, and you're just gonna relax and just be at peace. Go to your happy zone. Okay. And then hold on to your baby, and then this will be your tissue paper that you'll eventually need. And I'm going to give the instructions again just because I notice that sometimes people forget the instructions even though I've repeated it many times. So I'm going to go in. When I get as far as I can, I'm going to do a couple of small inflations. Okay. Once I'm back as far as I can go, I'm going to ask you to take a deep breath. And as soon as I see your lips close, that's when I'm going to proceed. So the only thing you need to do for me is when I'm where I need to be, I only want to see you take that deep breath, and I'm looking for those lips to close, okay? And that's my cue. Relax, relax, you're good, you're good, you're good, good. Don't tilt anymore. There you go, just stay where you are. Okay, good, there it is. Okay. You're okay, you're doing good. You're doing very good, you're doing very, very good. It's almost over. It's almost over. You're almost there. 30 seconds more. Okay, you're gonna take that deep breath. And close your lips when you're done. Take that deep breath. And close your lips. Take that deep breath and hold it. Close your lips. There. Good. Got it.
Oh my God.
Oh, and
Oh wow.
powerful. Okay, so that one is done. We need to restring a new balloon on that one. The inside balloon done, over. So we move on to the next one. Maybe we'll have to restring a new one before we end today. How was that for you, Marina? So again, this is good because the instructions, I want you to, because it's easy for you. It finishes very quickly when all you do is that. Not, you were doing,
And hold it.
I want you to go,
Oh, okay.
just that.
Just hold it.
Boom, and then it's over.
Okay, I was thinking.
Yeah, so you and I had some confusion, some misunderstanding, which prolonged the experience of discomfort. So if you just do, experience is short, boom, done.
Okay.
Do you exhale when you close your lips though?
No, so you're just doing an inhale, and then boom, done.
I did one.
Boom, release. Okay.
Whew.
Don't you feel good on that one side?
It's like a clear up there, you know. I feel different.
Yeah,
Because
it's
this side is full.
okay. Again, we're just gonna relax. Go to our happy place. You're doing good. You're doing really good. Okay, you're doing good. There it is. You're doing good. It's gonna open it up. It's gonna open it up. You're doing good. Okay. Now you're just gonna take that deep breath. There it is. Okay, good. Good, good, good.
It's great.
It's okay now. It's all over. It's all over. Good. Are you having some emotional release? Okay, open your mouth. Okay, let it go. There you go. Okay. Neck is better after that treatment, huh? And I can still feel it's better. Take a deep breath. Let it all out. Let it all go. Let it all go. There it is. Good. Take a deep breath. Let it all out. There you go. Let it all go. Good. She had a treatment yesterday, so we really softened her up pretty good. Okay, open one palm of your hand. Oh yeah, blow all that out. Can I see? Any blood?
No.
No, just the mucus? Okay. Open up one palm.
One palm. What does mean palm?
Palm, one palm. One palm of your hand. Rub your two palms together. Rub them together. And without touching your nose, without touching your face, take a deep inhalation. Take a nice deep inhalation. Good. Okay. How's that feel?
Oh, it's nice.
Was it nice?
Amazing.
Amazing?
Yeah, it's free.
Free.
Freedom.
Freedom. Hallelujah for freedom. Okay. And who is next?
Ready? No. Can I come?
I don't think anybody should be pressuring anybody for this right now.
I'm sorry, pressuring? Like,
Yeah,
nobody's pressuring anybody.
Yeah. This is all voluntary. It's all voluntary.
I mean, I'm gonna do it.
I want to do it last.
What's that?
I want to do it, but
Well, this is the time that
Okay.
we're doing this, guys, so.
We'll allow any guests go, and we'll also do Lily. If anyone who hasn't had it done yet, and then we'll do Lily.
Sorry. I just, it's like knowing how bad it is like,
Yeah.
It's good.
it's good.
Yourself. You deserve
Hurts
this.
so good.
You deserve this. No 2 times your life. Okay.
Just relax. Go into your happy place. Doing good. Doing very good. You're gonna have an amazing result. You're gonna have an amazing result. You're doing good. It's gonna be amazing. It's gonna be amazing. You're almost there. 3 seconds more. Take that deep breath.
Wow. I can feel like so many different parts of my body.
And we have one more opening to do. Just relax. You're doing good. It's gonna be amazing. Slight. There you go. Good. Relax. Close your eyes. Meditate. It's a little bit
Oh my gosh.
little bit of blockage there.
Yeah.
So I'm gonna go a little bit. There it is. There it is. We got it. There it is. Gonna go. There it is. We got it. And we're gonna take that deep
Sorry to cough on you. Good grief. Yeah.
And the last time?
It was like better than, it's easier than the last time.
Yeah, but what's more difficult about the second time is remembering the trauma from the first time.
Yeah.
So the second time is harder because you can remember the first experience. But after the second experience, you remember, oh, it's not so bad. And then it starts to get easier. The second one is the hardest. It's the hardest. People are like, oh, no. That was great. I highly recommend that, but I'm not going to do it again. You know, that's a lot of people, you know. They're like, well, that was great, but I know that was good, but I can't do that again. But if you can break through the second, now you can start to realize, okay.
And also the next day, if we are aware and notice and be mindful of, hey, how is that affecting me today and tomorrow? That would make, I mean, what would be like right now, noticing things, but in the coming days, we can take note of how it's making our cranial feel, right?
Yeah, and sometimes you feel like still like this, soreness here, you're like, oh man. But did you have a sore throat last time, Jackie? I think you did, yeah?
I'm definitely feeling it this time.
Yeah.
Just that like dryness, like you said, that thing hitting the back of your throat.
Right. Okay, so take a deep breath. Let it all out. There we go. Good. Okay, take a deep breath. Let it all out. There we go. Good. There we go.
Oh, jeez.
Dessert, right?
Actually, for me, when I think about the dessert, it's the essential oil, like the. I don't know, that's what I think. Oh God. Okay, open up one palm. Okay, rub your palms together without touching your nose or your face. Take that deep inhalation.
Tingles. Thank you, Dr. Nick.
Thank you, Jackie.